So now we'll be seeing about cardiovascular system. So under cardiovascular system, we'll be discussing it under the following headings, starting from cardiac adaptations, cardiac failures, the various types of cardiomyopathy, carditis, and ischemic heart disease and cardiac tumors. So now we'll start with cardiac adaptations. So like any cellular adaptations, these are also reversible changes only, which occur in response to a particular stimulus. So here the stimulus could be either an increased pressure or volume. So let's see pressure hypertrophy first. Since in cardiac muscle, the adaptation which we see here will be hypertrophy, pressure hypertrophy and volume hypertrophy results. So what is pressure hypertrophy? Due to any cause of increased pressure, like in a stenosis or hypertension. So suppose in a stenosis, if it is like this, so the outlet is going to be obstructed. So the pressure will be increased over here. This will result in pressure hypertrophy. And here the hypertrophy will be concentric. That is, it is going to be on both sides like this. It is going to be concentric and it is uniform. So when it is concentric, what will be there? Obviously, the transverse diameter of the muscle fiber will be increased. However, the length of the muscle fiber will be the same. Okay. However, if we see about volume hypertrophy, the causes of it will be regurgitation. So in regurgitation, there is extra blood volume which is added to it. So that is going to cause hypertrophy again. And here the hypertrophy will be eccentric. That is a non-uniform type of hypertrophy. At a particular corner alone, there will be hypertrophy. That is what we call it as eccentric hypertrophy. And in eccentric hypertrophy, there will be both increase in the transverse diameter as well as the length of the muscle fiber. So this is very important. The causes and the transverse diameter and the length of the muscle is going to be very important in distinguishing between the pressure and the volume hypertrophy. Next, we'll see about the various types of cardiac failure. We have two types of cardiac failure, which is left-sided heart failure and right-sided heart failure. The causes of both of which will be different. So in left-sided heart failure, the causes will be anything which leads to the decrease in the blood flow. So any hypertension, ischemic heart disease, or mitral or aortic valve disease like stenosis. So all of this is going to result in the ischemia to the heart, and that will result in the left-sided heart failure. So when the heart is not pumping properly, obviously the blood supply to other organs will also be decreased. So what are the organs which are affected and what will be their features? That we'll see now. So starting in left heart failure, it will be the lungs, which is the most commonly affected organ. So in lungs, what do you see? There will be pulmonary congestion and pulmonary edema resulting because of this left-sided heart failure. So when this pulmonary edema is present, what will happen is the congested blood vessels will burst open. So the RBCs which are present inside the vessels are going to come out into the extravascular space. When RBCs break down, it will be taken up by the macrophages. So macrophages will in turn eat up this RBCs which are broken down. And that is what is called as hemosiderin-laden macrophages. So hemosiderin-laden macrophages will be seen in left heart failure in the lung, and these cells are given a particular name called as heart failure cells. So remember, heart failure cells are cells present in the lung. That is, it is going to be hemosiderin-laden macrophages in the lung seen in conditions of heart failure. Okay, don't confuse it. Since this heart failure cells are laden with hemosiderin, they are containing iron. Hemosiderin is composed of iron, right? So how will you stain these cells? The special stain for iron we all know is Prussian blue. So Prussian blue positivity will be seen for this heart failure cells. And in brain, if you see, if there will be ischemic hypoxic encephalopathy. So hypoxic encephalopathy will be the feature we see in left heart failure in brain. Suppose in a kidney, there will be acute tubular necrosis resulting from the ischemia, and that type of acute tubular necrosis is called as ischemic acute tubular necrosis. So moving on to right-sided heart failure, here the causes will be different. So the most important cause of right-sided heart failure will be a left-sided heart failure. Okay, the left-sided heart failure will be the most important cause of right-sided heart failure. Apart from that, we can also have severe pulmonary hypertension, which is also called as cor pulmonale. So what are the organs affected in right-sided heart failure? The most common organs affected will be liver and spleen, and these organs are going to undergo congestion. So this will result in something called as congestive organomegaly. Suppose if it's a liver, it will be congestive hepatomegaly, and if it's a spleen, it's going to be congestive splenomegaly. In liver, what are the features we see here? The liver, the most important feature we see here would be a nutmeg liver. So nutmeg liver is nothing but if you had seen a nutmeg, you'll know on the cut surface of the nutmeg, it will appear like darker areas and some tan kind of lighter areas. So that is the classical appearance we see in a congestive hepatomegaly. And this darker areas are nothing but red color necrosis, hemorrhagic necrosis areas, which are seen around the central vein. Okay, so in liver, we all know the zones. In the hepatic lobule will be this central vein will be here in the center, and at the corners we have the portal tracts. So around this area, the central vein, we have this hemorrhagic necrosis, and that is what will appear red colored. And these periportal areas are going to be preserved. So these portal and periportal areas will be preserved and normal, and those are the normal yellow colored areas. So this nutmeg liver will see in right-sided heart failure. In spleen, I already mentioned it will result in congestive splenomegaly. And that in congestive splenomegaly, we see a feature called as gamma-Gamdy bodies. So gamma-Gamdy bodies are composed of hemosiderin along with calcium and fibrosis. So if you have to stain for this gamma-Gamdy bodies, you can use pearl stain because it will stain the hemosiderin, while von Cosa stain, which is a special stain for calcium, can stain this calcium particles. So gamma-Gamdy bodies can be stained with Purcell Prussian blue and von Cosa stain. So now we had seen about the cardiac failure also.